Yeah.
Hi, my name is Jamie. I'm from Atlanta, Georgia. I'm talking funny because I have my appliance in now. Um, I, throughout my life, I've had several different head injuries to my TMJ region. I was dropped from a cheerleading stunt directly on my chin onto concrete, and I've been told I had TMJ problems most of my life. Um, I have a lot of back problems. I've been told that I had fibromyalgia for at least 10 to 15 years. And I have flares that no one can even touch me. It hurts so much. In the fall of 2011, I began having major trouble with my front teeth. I began with an abscess and moved on to 14 different visits to the doctor, to 8 dentists, probably 6 to 8 different dentists on one tooth. Finally discovered that we needed a root canal, ended up with 2 separate root canals on my 2 front teeth. 2 of the dentists wanted to pull my 2 front teeth at 35 years old. Was not interested in that. Attempted some somewhat orthodontic treatment with some Invisalign. Never worked. Was finally told after about 6 months of agony that I had trigeminal neuralgia. Found a neurosurgeon in Atlanta who agreed to do the microvascular decompression for trigeminal neuralgia, which is essentially where he went in behind my right ear, used and raised my brain, the base of the brain, found the vessel that was pressing onto the trigeminal nerve, separated it with Teflon foam. He also cauterized a vein that he thought was also pressing. When I woke up from that surgery, the pain in my face that I had been feeling and in my teeth was gone instantly, but I had the worst pain I can ever. There's no way to describe the pain. 1,000 on a scale of 1 to 10. I've had 2 C-sections. I've been in multiple car accidents. I've had a ruptured disc in my back. Nothing compares to the pain that I had. Fast forward over a lot of agony, over a year. I was in bed approximately 18 hours a day for about a year, and I have 2 small children. Finally, after seeing every doctor I could think of, from infectious disease, multiple neurologists, multiple neurosurgeons, multiple general practitioners, multiple pain specialists, I was directed to another neurologist who, ironically, I went to high school with. And I sat in his office one time and he said, "You have complex regional pain syndrome and you need to get ketamine as fast as possible." That was in February of 2013. Since then, I have been doing high-dose pain ketamine infusions in Atlanta approximately every 2 months, along with a variety of nerve blocks that include ketamine, Botox, lidocaine, a variety of other medications. I do 2 infusions 2 days in a row, 4 hours apiece, extremely high dose, and I get approximately 8 to 10 different IV medications on each one of these visits. I was told by a friend that I was introduced to, who also has complex regional pain syndrome, about Dr. Sims. After fighting with my insurance company and going through all that, I flew here on Monday, which was December the 29th, from Atlanta. Dr. Sims helped me to get all of this done within 3 days. And the first day I was here, in the testing phase, he tested approximately 25 to 40 points on my head, and I was coming out of the chair. And I think I hit him a couple times, which was not very nice, but it hurt. He put 4 tongue depressors in my mouth, right hand side, and the second time he tested, there were only about 1/3 of the points that were hot. He put 5 tongue depressors in my mouth, and I only had 3. Now I have this in my mouth, and as I just told him when he was going out to adjust it, I wanted to chase after him because I am literally pain-free right this minute. And I can't remember the last time I was able to say that. Probably before I was pregnant with my daughter in 2009, and even then I still had the fibromyalgia and back pain and everything that occurred prior to my trigeminal neuralgia surgery. Everyone I've spoken to in the past 3 days, I've used the word miracle. I don't know what the future holds with this crazy thing in my mouth, but I'm very excited to find out. And I thank God that even if the mainstream medical establishment doesn't understand what he's doing, that Dr. Sims is willing to do it. Thank you.